My name is Mr Ben Eddy. I'm a consultant urological surgeon specialising in urological cancers. So prostate cancer is a very common disease now here in the UK. Around about 45,000 men are diagnosed with it per year and around about 11,000 deaths. So we're very keen to pick up this disease early at a time when it's treatable. We're particularly after diagnosing it in at-risk groups, patients with a strong family history for prostate cancer. We would like to see patients that are a black population are more at risk, and patients that are obese are also potentially more at risk of prostate cancer. And these are patients that we'd like to see. So the majority of patients with prostate cancer that I see actually don't have any symptoms at all. They come to see me on the basis of a positive prostate blood test, the PSA test, or the GP has done an examination of their prostate, which is positive. And if there's any of these signs, these patients are then referred in to see their local urologist. If prostate cancer is symptomatic, it can present with urinary tract symptoms. So symptoms of a slowing of the urinary flow, getting up at night to pass water, an increased frequency during the day, or a feeling of not emptying the bladder properly. These are all potential symptoms. Also symptoms such as blood in the urine or urinary tract infections can lead to a diagnosis of prostate cancer. Or if patients have got more advanced disease, they may have back pain or bony pain related to the disease. So on the whole, when patients go and see their GP, they will have an examination of the prostate. Men shouldn't be embarrassed by this. It's a very quick examination, relatively comfortable. It's not painful at all. And in a lot of cases, this examination potentially could be life-saving for our men. In addition to that, they will have a PSA test. PSA stands for prostate-specific antigen. It is a blood test, and it indicates whether a patient then needs to go on and have further investigations or not. And at that point, patients will be referred into us to see us as urologists and decide on the next step of investigations. If a PSA test is elevated, we will then now consider to do a specific MRI scan of the prostate. This can be a little claustrophobic for some patients. It takes around 40 minutes, but we can identify some disease within the prostate, and that can help target our next step of investigations, which would be prostate biopsies. So once we've done the MRI scan, we can then decide whether a patient needs prostate biopsies or not. We can exclude prostate biopsies in some patients on the basis of the MRI, but if we do see a lesion on the MRI, we would want to proceed to prostate biopsies. There are a couple of different ways of biopsying the prostate. Our favoured way here at One Ashford is what's called the transperineal route, or template prostate biopsies. These are biopsies done under a short general anaesthetic, which is more comfortable for the patient, through the skin underneath the scrotum. We're able to sample the prostate in more detail. We're able to target the areas specific on the MRI scan and get a more accurate representation of potential disease inside the gland. This route also has much lower infection and sepsis rates and is more comfortable for the patient. So if after the prostate biopsies a man unfortunately gets a diagnosis of prostate cancer, treatment really depends on how advanced it is. On the basis of a prostate biopsy, our pathologists will look at this and will give us a grade of the prostate cancer. We essentially grade prostate cancer on a score between 6 and 10. 6 being the really mild prostate cancers, which are rarely life-threatening, and 10 being the most aggressive ones. Patients now with grade 6 disease, on the whole, we don't offer treatment. We just watch and wait and offer surveillance and just make sure that the disease is not growing. If it does grow or change over time, we would then instigate treatment at that point. But a lot of the men with low-grade disease can live many years, 10, 20 or even 30 years, without the disease becoming life-threatening. For those patients with higher grade disease that have got a good life expectancy of 10 years or more, we would consider offering treatments. And treatments are variable. There are a number of different options that we can offer our patients, and patients will discuss surgery, which is total removal of the prostate, with their urologist, but they will also discuss radiotherapy options, either external beam or brachytherapy, which is radioactive seeds implanted into the prostate, with our oncologists. And us as urologists work very closely with our oncologists to decide on what is the best form of treatment for our patients. And we try to individualize treatment options as best we can for our patients. What I offer is surgery for prostate cancer. We do what's called robotic radical prostatectomy. This is robotic surgery, keyhole surgery for prostate cancer. We have a vast experience in this operation, having been doing it for 10 or 11 years now, with experience of over 1,300 cases. We talk to patients about the successes of the treatment, but we will also inform patients of the potential risks of the surgery. And the main ones are, in the short term, incontinence and loss of sexual function or erectile function. And we'll be very keen to go into the details of the recovery of these aspects with our patients. So here at One Ashford, we are very keen to be able to rule in or out prostate cancer as quickly as we can for the men concerned that they might have a raised PSA or an abnormal rectal examination. We have worked with Check for Cancer, a charitable group, and have started a rapid access or quick investigative pathway. This will involve having your MRI scan done immediately on receipt of referral, and then to see myself with the results of the MRI within 5 days. We can then decide there and then whether a patient needs to proceed to prostate biopsies if they've got a high risk of prostate cancer, or whether we can rule out prostate cancer on the basis of that MRI. If a patient needs to go on and have prostate biopsies, we can do that within 5 days and get a result back within another 5 days after the biopsies. This gives patients a very quick turnaround time and full investigation pathway, much quicker than we can offer in the NHS. So if any men are out there that are concerned about potentially having a prostate cancer diagnosis and they're over 50, we'd be more than happy to see them here at One Ashford and arrange their PSA testing and subsequent investigations if they need it. If they have a positive family history or they're one of these at-risk groups and they're under 50, we would still want to consider seeing them. And we'd be more than happy to see you here at One Ashford for investigation of this.